Welcome to this audio guide for talking head pain, produced by the Global Healthy Living Foundation. Whether you or someone you care about have migraine, or think you or they might have migraine, these audio guides are designed to help you make sense of the headache and other symptoms. Accurate information will help you work together with your healthcare professionals to hopefully have fewer and less severe episodes. Please remember that headache of any kind is a medical issue, and always talk to your healthcare team if you have a headache that bothers or worries you. In this audio guide, we'll discuss what migraine is and what makes it more than just a headache. In every audio guide, we provide information that has been checked by medical professionals specializing in the treatment of migraine and other headaches, and people living with migraine who understand what it is like. Suggestions for care are based on guidelines from the American Academy of Neurology and the American Headache Society. Most people get a headache at least once in their lives, whether from a viral infection, allergies, a bump on the head, or a stressful day. Many people, however, have headache attacks much more frequently, from a few times a year to 2 or 3 times a month, 3 or 4 times a week, or even every day. These more frequent and recurring headaches are often episodes of migraine, a medical condition that affects 1 out of every 8 people in the United States. Not every headache that happens repeatedly results from migraine, and other headache conditions exist. Although these are much less common, you can find out more about that in our Diagnosis Audio Guide episode. What is most important to remember is that getting headaches regularly is not something to brush off or let others brush off for you. Repeat headaches from any causes, migraine, injury, or anything else are a medical problem that can be treated, and anyone with regular headaches of any kind deserve relief. So, who are the 1 out of every 8 people with migraine, and could one of them be you? Although migraine is more common in women, it is just as unpleasant and painful for the 1 out of every 16 men living with migraine. Migraine can occur at any age and is most common between the ages of 18 and 44. Anyone can develop migraine, but it is more common in people who have family members with migraine and in people with sleep disorders, epilepsy, depression, or anxiety. When you talk to your healthcare team about diagnosing your headache condition, it is important to share information about you or other people in your family who have any of these conditions. We'll cover that in more detail in Audio Guide 2. How do I know if a headache is a migraine? The headache of a migraine episode is often described as a throbbing pain on one side of the head, but it can occur on both sides. Sometimes migraine attacks don't include a headache and are just as awful as the ones that do. This is because migraine episodes are more than the headache. By definition, other symptoms occur during a migraine attack. Those other symptoms include changes in vision and being very sensitive to light, sound, and smell, or having nausea and vomiting. Many people also have fatigue, sleepiness, and mood changes, or feel lightheaded, weak, or numb. Difficulty thinking or concentrating, or brain fog, may also happen. Movement or physical activity usually makes the pain worse. Often, a migraine makes people, especially children and teens, seek out a quiet, dark space where they can be as still as possible. Some people find sleep helpful, and others find the pain and other symptoms keep them from sleeping. It is important to recognize that not everyone has the same symptoms as other people, and even though most people with migraine can describe their typical attack, not every migraine episode, even in the same person, is always the same. How long do migraine attacks last? Some people notice vague symptoms of fatigue, irritability, or brain fog before an attack begins. This is the prodrome. A stiff neck, nausea, and changes in appetite are also noticed by some people. Whether a person has a prodromal period or not, they may also have a noticeable pattern of symptoms, called aura, a few minutes to an hour before the painful headache and other symptoms. Usually, this is changes in vision with zigzag, wavy lines, and halos, distorting shapes and images, changes to other senses, or difficulty speaking or moving. About 1 out of every 3 people with migraine has aura, with some or all migraine attacks, but most people never experience aura, and only some experience prodrome. The attack phase may last anywhere from 2 hours to 3 days, and includes the headache of moderate to severe pain, sensitivity to sound, light or smell, and nausea or vomiting. Brain fog and severe fatigue are common. This is when many want to escape to a quiet, dark place where they can be still. After the attack, there might be a postdrome, during which people feel groggy or just not quite right for a while. They may have remaining sensitivity, fatigue, mood changes, and brain fog. So, what causes all this? Current research suggests that it is mostly genetic, with environmental and lifestyle factors affecting severity and frequency. The biologic response of a migraine attack starts with overactivity in a part of the brain called the brainstem, which connects the brain to the spinal cord. During the overactivity, certain substances are released, and nerves and blood vessels react in ways that cause the sensory changes and pain of an attack. Some of the newest migraine medications affect those released substances directly. We discuss this more in Guides 3 and 4. You may also have heard about migraine triggers, that having a glass of red wine or eating chocolate make migraine attacks happen. The latest research shows, however, that even if certain foods, drinks, and environments make a migraine attack more likely, these are not the actual cause of the attack. It has also become clear that what triggers, or makes an attack more likely, for one person may not be a trigger for another person. In other words, your triggers are not necessarily my triggers. Also, what seems like a trigger for a migraine attack, like craving and then eating chocolate or other sugary foods, may actually have been triggered by the migraine attack and not the other way around. Migraine can make you more sensitive to things like spicy foods, so you notice the spiciness more if a migraine is coming on than you would otherwise. Unfortunately, this can lead people to blame themselves, thinking, I should not have eaten, drunk, or done, fill in the blank. What is useful about triggers is that if you do identify something that often happens right before an attack, or makes an attack worse, you can try to find ways to avoid it. To identify your triggers, keeping track of your migraine attacks with a headache diary can be very helpful. As we'll discuss in Audio Guide 2, this can also help your healthcare team find a correct diagnosis for your headache and guide treatment options for you. Keeping a migraine diary has become easier because there are apps for that. Of course, you can also use a simple notebook and pen. To keep a headache diary, the essential items to record are the date and time it started and ended. For each day it lasted, how did you function? Many find the stoplight approach helpful. A red light for stopped functioning, a yellow light for slowed or decreased functioning, a green light for your normal functioning. It is also essential to record where the pain was, what other symptoms you had, what medicine you took and how it worked, whether you were taking any other medications. It can also be helpful to record how well you slept the night before, whether the stress you've been experiencing was mild, moderate, or high, whether you had been drinking water, staying hydrated, whether you had been eating regular meals, if you ate or drank something known to trigger migraines for some, red wine, chocolate, aged cheeses, or highly processed foods, what activities you were doing before the attack, such as a longer than usual work day, a late night out with friends, vigorous exercise or missing regular exercise, and any other change in your usual routine. Environmental factors like bright lights, screen time, changes in the weather, noise levels, or exposure to chemicals like cleaning solutions or drying paint. For people who menstruate, where you were in your cycle, and anything else that you frequently notice during an attack. Understanding any pattern to your migraine can help you avoid the things you have control over and lead to better health overall. However, it is rare that lifestyle changes alone eliminate migraine attacks. Remember that migraine is a biologic disease, not about what you do or don't, but about how your brain chemistry is working. Now you know the difference between headache and migraine, and if you feel as though you may suffer from migraine, you can find information in our Migraine Diagnosis audio guide. If you have already been diagnosed and are wanting more treatment options, listen to our audio guide on migraine medication options for migraine. We also discuss lifestyle changes and medication alternatives in Non-Medical Migraine Therapies audio guide, and the common challenges of migraine on our Managing Migraine in the Workplace audio guide. For more medical information and advice about your own migraine treatment, speak to your doctor.